Well, good morning or good afternoon, depending on where you're coming from. Um, Thank you for joining my talk, Designing for Women's Health, Why Technology Software Solutions Need to Think Specifically. My name is Tracey Welson-Rossman, and I am the founder of Journal My Health, a health tech platform to help people with chronic conditions better tell their health stories. And I also have another role as Chief Marketing Officer of Cherry Solutions, a software consulting firm located outside of Philadelphia. I'm sure you learned much over this conference, but I hope that over the next 20-ish to 30 minutes that I can give you a different perspective about healthcare and where software technology can play a part, having these companies have a better idea about thinking and implementing solutions that take women into consideration. So first, a little bit about me and what puts me up on the virtual stage talking to you about this topic. For the last 20 years, I've been part of Cherry Solutions, working with all different types of companies to help them better use their software solutions to solve complex business challenges. What software and hardware can do now is so much more powerful than when I started in the field. And there's so many new positive changes ahead. And coinciding with this period of my life were two personal matters. The first, a car accident, which put me on a healthcare journey. The second, advocating to support girls and women in tech with a nonprofit that I started. You may kind of wonder how these seemingly disparate experiences come together, but I began to see how technology could play a part in my communications with my doctors and how we as creator of healthcare solutions should start thinking more proactively about designing solutions that take women into considerations. So Journal My Health was an idea that I had based on my understanding of being a patient with a chronic condition and the need to capture information about my symptoms and treatments and other daily specifics about my chronic issues. First, to help me better understand my patterns and my trends, and then to also better communicate with my healthcare providers, which at one point was numbering 8. It's a lot of information to organize. I knew that I could use technology to bring self-reported data into a better organizational structure, but also bringing in other data that lives on my phone as well as on my wearable devices. Bringing all that data together and then being able to visualize it in a way that I could then share with my healthcare circle and myself to see those trends, I knew that that was going to be really, really helpful. Like any other good startup, I started Journal My Health by using something called the Lean Startup methodology. Lean Startup gives a structure to how startups can do the research to take an idea from paper or in your head to minimal viable product, and then to continue to develop your product. Lean Startup is an approach to build that helps new businesses and even established businesses. And it's based on the belief that you have to investigate, experiment, test, and iterate as you develop these products. So right now, we're going to go through an exercise that focuses on product development with women in mind as we create our digital health product. So the first thing I wanted to do was really have an understanding of what a digital health product was. And it consists, the World Health Organization has given us a super definition. Digital health is a broad umbrella term that incorporates e-health, as well as the application of technologies such as artificial intelligence, big data, and there's going to be more in the future. The goal of digital health is to provide cost-effective and enhanced medical services by combining, you guessed it, technology and healthcare. The latest trend that's happening in digital health is exactly what Journal My Health is trying to do, which is health tracking apps and wearables. Digital health also includes telehealth and telemedicine. The global digital health market size was valued in 2021 at $181 billion, and it's estimated to grow to $1 trillion by 2030. So that's the healthcare side. Let's learn a little bit about what's happening with women. In the United States, women comprise over 50% of the population. And just that fact in itself should make us take note of the size of the potential market our solutions can impact. Part of this edge is due to the fact that women live longer than men. As the population ages, we need to think about the statistic as we are developing solutions, whether they are tech-enabled or not. Women will be the primary users just due to their longevity. Another piece of information that we have to think about is education attainment. Over the last 10 years, in Europe and the US, more women than men are completing higher levels of education. And that goes in the US, women are greatly outpacing men in college degrees. Why do you think this is important to take note of? Well, education shapes your employment opportunities and your income, which also happens to be one of the determinants of good health. Improving education increases our health knowledge and health behaviors, our literacy, our coping, and our problem-solving skills. Education is also one reason for women beginning to gain economic parity with men. Women are controlling about $90 trillion of investable assets worldwide by 2023, and their spending power is projected to be $18 trillion globally in the next year. It's a lot of things that we're buying. But even before our increased spending power and our increased incomes, women were making 80 to 85% of all consumer purchases in these two parts of the world. Beyond consumer buying decisions, women have been shown to make 80% of the healthcare decisions for their family. But the spending and the decision-making power isn't translating to companies properly connecting to women. As a recent survey just showed, not only 9% felt that they were being marketed to effectively. Other surveys directed towards how products and services are designed showcase that women are feeling that they were left out of the process. Close to 70% of women felt healthcare products did not take their needs into consideration. So as companies are thinking about designing products, it can't just be pink it and shrink it. They really have to think on the difference in the usage by women versus men. Now, we know about their economic power, their buying power, and how they feel that they're being left out of product design. Let's talk about how women are working within the healthcare industry itself and how they're using healthcare services specifically. So more women than men are consumers of healthcare services, and they're spending more money. So of course there's two easy issues to pick up there. Biological differences, pregnancy, menopause, menstruation cycles, and as we said before, women are living longer. We know that healthcare is a big business. $4.1 trillion are going to be spent in the US alone. But even though women have have these two factors which show that they are spending more money than men, it's only been the last few years that we've begun to see something called femtech. And femtech has become part of the health arena. Femtech seems to be more focused on the unique set of healthcare challenges and needs that impact women. So it's menstruation and pregnancy, postpartum, perimenopause, and menopause. So this is easy for healthcare to participate in. They set us apart from men. And we're definitely seeing that businesses are seeing the economics around this. And of course, economics gets business attention. There's more femtech companies that are out there, and there's capital that's flowing into these products. McKinsey & Company has recently had a report that estimates the size of the femtech market between $500 million and $1 billion, $19 billion this year, with predictions of up to $75 billion by 2025. So clearly, solutions that are being designed for women or women's specific needs are certainly generating dollars. But femtech should actually be a broader conversation, because women are at a higher risk of developing certain conditions and diseases than men. The leading cause of death for women include heart disease, cancer, and diabetes. All of these can be potentially treated and prevented if they're identified early. And I'd just like to point out that women make up 80% of those who have one of 100 or so autoimmune conditions. That's 20 million women in the US alone. Women's health research is critically important, and there's been a lack of dollars of interest that's been invested in this research. There's facts that show that disease manifests itself differently in women than in men, and that women also respond differently to treatments and medications. But we've seen, not just the dollars not being invested in research, there were some other blockers. Specifically, the FDA between 1977 to 93 restricted women of childbearing years from clinical trials. Their rationale was that female and male bodies were generally the same, and that hormonal fluctuations due to menstruation cycles would complicate the analysis. Clearly, the market is here for health and wellness products for women who have been seemingly ignored by companies. One thing I didn't do was actually take a look at all the new femtech companies and seeing if all of them are led by women leaders. It's not just about designing a product that is specifically for women, but thinking specifically how it is going to be used. So we've done some investigations, so now we're going to get to the experiment. At Journal My Health, we knew women were going to be an important segment of the people who we would market to because of the number of women who were impacted by chronic conditions, the heart of who we wanted to serve. We also knew from other reports that women felt less heard at their medical appointments than men did. So having data would be helpful for them to prove their medical issues. We did not look at anything in our software design which was gender specific, but we knew having more women involved in our focus group was really important for focus groups. As part of the experiment phase, we created our screen designs and began to show them to potential customers and healthcare professionals for feedback. We began to test our product when we released our first version of the app in May of 2021. We did not take names or other identifying demographic information, so we were in the dark as to who was using it, except for when we heard from our users who had questions about support or ideas for new features and other changes. Of course, we started to keep track of these suggestions, and we also went back to our original focus group and testers to ask for their ideas for new features as we started to put our product roadmap together. One of these features happened to be a period tracker. We had a large number of new features after we went through updating our app with some core features that we were adding in for our roadmap. In fact, I think we had like 12. We had ideas about which features we should be prioritizing, but they were only theories. And, I hate trying to guess what customers are really, really thinking and what they really wanted based on our own biases. We decided that the best way would be to test what features should be pushed ahead. So that we decided to put a survey online, and then following that with in-depth interviews with those who had answered the online survey. From our survey, we realized we were lopsided to who was using it. Women versus men by an estimate of 65 to 35%. At this early stage of this product, we had not gone with this gender focused message yet. We were waiting to do that. So this was even a larger split than we had predicted. On the digital survey, period tracking was the #1 feature, squeaking out medication tracking in our users' answers. When we put out the ask for participants for the 20-minute in-depth face-to-face interview, all of the people who replied and were interviewed were women. It became super easy to have that discussion of why period tracking. These women knew anecdotally that their cycles were impacting their symptoms and wanted an easy way to compare to their symptoms. They were using other apps, but stated they would stop using those period tracking apps and fertility apps if it was built into ours. That was really surprising to me. We also began to do some research into our competitors' apps and found that these were not built into their apps. So we began to have a competitive advantage. Now it was time to build it again and to get to the next iteration of our app. Now, one thing I should note, we went through another piece of research to see if there was any statistical research out there around how menstruation cycles were impacting chronic conditions. And not surprisingly, there wasn't any research that we could find, or just like one little piece. So we were kind of in the dark around this. The team went through, as we were figuring out how to design this, of whether to connect with the leading existing apps, just like we had pulled in information from the weather app and from the fitness apps, the fitness devices that we were connected to. We looked at existing apps like Flow, which is a leader, or the new cycle tracking feature at that point, which was in Apple Health. Upon investigation, we found these apps were serving a much different purpose than what our users wanted or needed. Our focus groups, they were very fertility and sexual health oriented, which I totally understand. That's what they were built for. Our focus groups have made it clear that they only wanted to track when they had their periods, and compare that timing to their symptoms in an easy way. So we decided to make it simple. Don't track your period, and that is it. So did we make the right choice? Was the feature being used, and did our customers like it? What was the impact? We released the new feature in March of this year. It came out just about the time of the leak of the Supreme Court ruling around the Dobbs Roe v. Wade decision, and there was much discussion around period tracking apps and the potential for weaponizing this information against women who were seeking abortion in states that were outlawing abortions. We decided that it was important to keep the feature because we knew this feature was being used specifically for a comparison standpoint. We issued a statement that, it was easy to turn this feature off on our app if someone so desired, and that you could delete the feature, but we could delete your information at any time. We decided that we would start advertising and discussing this new feature on social media. Since its release, in a short period of time, we've seen close to 25% of our active users and new users use this feature. We have also seen an increase in the number of new users of Journal My Health as we go out and talk about it. Most importantly, we are hearing from our users that the feature is helping them better understand the correlation between their cycles and their symptoms, allowing them to have discussions with their healthcare providers, or understanding how they can manage these changes on their own. This seemingly small change will have an outside impact on our end users, the businesses that we're going to be working with, and I believe on the growth and trajectory of Journal My Health as we figure out how to further work with the majority of people who are using our app, which are women. So I want to thank you for spending time with me to think about how we, as people in the healthcare industry, especially in health tech, can design more specifically for women, form the majority of our population. Please feel free to reach out to me at twr@journalmyhealth.com to follow our journey or ask some questions. And then we're on Twitter at Journal My Health, one, no H. And I hope to hear from you. Thank you.